everyone. My name is Christa Natoli. I am CTeL's Executive Director. For those new to CTeL, CTeL stands for the Center for Telehealth and eHealth Law. We would like to welcome you today to our CTeL Telehealth Policy Scoop. This is a podcast where we explore the intersection of technology, policy, and the future of healthcare. Today, we are thrilled to have Dr. Amir Hadid with us. Dr. Hadid is the leading researcher in the field of digital health and recently co-authored a groundbreaking study on the use of wearables and AI to predict inflammation before symptoms actually appear. Dr. Hadid, thank you so much for joining us today and welcome to our show.
Thank you for having me.
So, Dr. Hadid, you have such an impressive resume. Would you mind giving us a little bit of background on who you are and introduce yourself to the CTeL audience?
Sure, no problem. Well, I'm a biomedical engineer by training. I spent 6 years working with very capable people, very healthy people, special forces soldiers, trying to make sure that they perform as intended and actually try to prevent health injuries, in the crazy things that they do. And already 20 years ago, we did what we call today remote patient monitoring. So we did it back then when we didn't have all these fancy sensors and medical devices. We had to invent the wheel. So it was a very nice experience. Then I had the opportunity to lead a company called LifeBond. It's a biomedical device company. We started from early stage until eventually we sold it to Becton Dickinson, a US-based company. But throughout this journey, it was amazing to see how late we are treating people, right? I mean, I was traveling in many hospitals around the world. It doesn't matter if it's the US, Europe, the Middle East. We practice medicine the same, and people have problems. They come to the clinic, and then the surgeon say, "Okay, you need to undergo the surgery." And then during the surgery, they have complication, and then we, the engineers, find solutions for these complications that happen during the surgery. And it didn't make any sense to invest all this money and all this effort, so late in the journey of the patient. So if we could actually, catch these things early and prevent them, this would be much more efficient in terms of where we spend our dollars for the healthcare system. So after 10 years there, which was super successful, and we developed an amazing product and it was sold to an amazing corporation, I decided to spend the next year on preventive medicine. And this is what I do today, and I'll be happy to elaborate a little bit more about this.
Well, that's amazing. CTeL is a health policy research institute, so we usually see or hear the clinical side of a lot of these models and what they're trying to accomplish. But every time we talk to physicians or clinicians that have an expertise in chronic conditions, they usually say that the root cause is inflammation, and that if a patient was able to identify that this inflammation or this root cause was the problem, they could have potentially prevented a medical catastrophic. And for those that don't know what medical catastrophics are, those are medical conditions that ultimately end in a patient having serious deficiencies. So they're not able to walk anymore, they might not be able to talk, and this causes a lot of stress, not only on the healthcare system, the family, but also on resources for those that are paying for the healthcare. And to be able to stop that on step one, that's huge. So Dr. Hadid, you're doing incredible and timely work. Prevention means a lot in the area of chronic condition and being able to stop these medical catastrophics. I read that you have recently been working with McGill University on a publication. And I'd like to learn a little bit more about that because CTeL is a research institute not only likes to hear about great ideas, we like to hear about great ideas that are backed by peer-reviewed research and science. So can you tell us a little bit more about your team and how they developed an AI platform that could predict acute and systematic inflammation using data from something as simple as smart rings and smart watches?
Yeah.
And even t-shirts, I was told.
Yeah, it's not so simple, T-shirt. I'll speak about
Yeah.
this in more detail, but yeah, sure. So we started before the pandemic. So 2019, I had the opportunity to meet Professor Dennis Jensen, who is an expert in respiratory physiology, and Dr. Emily McDonald, who is an expert in internal medicine. Both
Mhm,
very well accomplished in their fields in McGill University Health Center, and I joined their team as a researcher, and we brainstormed together how can we detect inflammation non-invasively. So today, like you said, inflammation is involved in probably 50% of the morbidity in the world.
mhm,
So in different conditions, you find that the root cause is inflammation, from cancer to autoimmune disease and even diabetes, which is so common, right?
mhm,
But the thing is that in order to detect inflammation, you need to take a blood sample. So,
mm,
and people don't really take blood samples every day. We do it maybe once every year, right? And 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 then when you look at inflammation, you look at things that are, very prominent, and it's like 1 point in 365 days. So it's not really informative. You can't really take decisions. You can't see the trend. But for some populations, it's really important to know what is the trend. I mean, is something brewing? Are they getting better? We can and we need continuous information. So we started to brainstorm how can we detect inflammation non-invasively using wearables. We started to look at rings, watches, biometric shirts, stuff like this, and we really had no idea what signal we need in order to detect inflammation. And then the pandemic started, and we realized that what we are doing is so big because the humanity coped with the pandemic using this thermometers that we pointed to people's forehead, right?
mhm.
Trying to
Yeah,
see if we have fever.
right.
But fever is not a great marker because fever actually develops late in the onset of the infection. So by the time somebody detected fever, they
Mhm,
already infected 50% of the people they spoke with. And in reality, the strategy to cope with the pandemic failed. We didn't cope with the pandemic successfully. So we realized that what we are developing can be a very sensitive tool that can help also to cope with the next pandemics that I hope will not happen, but better to be prepared. And in order to do that, we said again, instead of waiting for symptoms to appear, we don't want to ask patients, how are you doing today? We want to ask the immune system, how are you doing today? So
ah,
we designed a very nice study that is called the WISN study that was recently published in the Lancet Digital Health. And there we wanted to create a controlled bump to the immune system.
mhm,
So we brought healthy people. Each one of them got the Oura ring. And again,
mhm,
5 years ago, we didn't know if it's going to work, right? They were not so common like they are today. We used a medical watch that can also, it's an FDA grade watch that can monitor blood pressure, and the AstroSkin, which is a smart shirt.
mhm.
This shirt was designed for Canadian astronauts. It's an $8,000 shirt, super fancy with ECG and respiratory signals. Basically, the most extensive physiology you can detect on,
Yeah.
on humans. And so we covered all of the physiological signals using these three wearables. And then after 1 week that these people came to the hospital and they were completely healthy because we monitored them that they don't have anything in the background. We actually challenged their immune system with the live attenuated influenza vaccine. So basically, it's an influenza, but not the fully potent one. It's just creating a runny nose and sometimes even not symptomatic at all. But again, it's a
Mhm.
vaccine. And the idea was that we want to challenge the immune system a little bit. And if we
Mhm.
can detect this using these sensors, then we can detect also real influenza and COVID and other things.
Mm.
And in order to detect how people react, we took blood samples twice per day. So actually creating the inflammatory profile for each person. So imagine that your immune system is starting to work after
Mhm.
you get an infection, right? But
Mhm.
your baseline is your individual baseline, and then your inflammation levels move from your personalized baseline. They might be
Mhm.
completely normal for the population, but they are not normal for you, right?
Ah.
So we created a personal signature for each person of the inflammation. And then the last step was to connect the dots between the physiological signals collected from wearables and then the personalized inflammation signature collected from the blood samples. And for this, we used AI, and we were amazed by the results because we found that we can detect 90% of the cases early. It means that it doesn't matter if we take the ring, the watch, or the shirt, we can detect 9 out of 10 immune responses, which is an amazing sensitivity. We did not expect it to get to this level at all. And from here, the sky is the limit. I mean, the applications are huge. So we were, very happy with the results, and now we are trying to think about who are the people that can benefit from this the most. And yeah, and this is the reason why the Lancet adopted it, so easily.
Well, and you bring up a great point. You know, the potential for proactive rather than reactive medicine seems to be this reoccurring theme in your research and also in this discussion, but specifically about digital health. The administration is very passionate about the use of wearables and medical devices as a way to prevent a patient from getting sicker. So, how do you see this technology being applied in real world clinical settings? Um, if I was to go to the doctor and I presented with diabetes or if I presented with COPD, how is this going to help me as a patient in real time?
Yeah, that's a great question. And again, we had a lot of brainstorming, and many people actually approach us and say, "Hey, we have this patient," especially clinicians. We
Yes.
have this patient, for example, rheumatologists. So they have these patients that have flares, and they believe with our technology they can detect it early and give them intervention at home. But I will give an example that we think is very painful, and this is COPD, chronic obstructive pulmonary disease. These patients have chronic levels of inflammation in their airways, right? And
Ah.
then what happens when they are infected with the common cold virus, right? Rhinovirus. This can be a life-risking event for them because it creates additional level of inflammation that creates an exacerbation. So this is common cold that probably, you and I will just have runny nose. These
Mhm.
people can actually get to the emergency room because of this, and it's a life-risking event for many of them. So they live with a great anxiety because they don't know when it's going to hit them.
Mhm.
So every scratchy throat, they run to the GP, and then the GP test, and they say, okay, you have nothing. Then they go back. So it's first people live in constant stress. Then it's a healthcare utilization, right? Because they use GPs sometimes when there's nothing.
Right.
And then if you give them a wearable, for example, right, and we learn their own immunophysiology pattern, when there is
Mhm.
a surge, which usually we detect before the onset of symptoms, 24 to 48 hours before, we can tell them, hey, something is brewing, and start your action plan. And these people, like in asthma, they have their inhaler. Also, COPD patients will have rescue medication, which can be an
Mhm.
inhaler, it can be another medication, but usually they have it already, but they
Mhm.
don't know when to start. And the critical part is to start early because then you can prevent the exacerbation and you can prevent the hospitalization. So you can imagine that hospitalization in Western countries, it's not only in the US, but
Right.
US, Canada, and also Western Europe, each hospitalization of COPD exacerbation can cost between $10,000 to $20,000. if you catch it early at home and you give the action plan, which is a very benign medication, they have it already, you prevent exacerbation, you save a lot of money for the payers, and you prevent hospitalization. Like you and Lindsay said, it's even if the hospitalization outcome is positive medically, right? It
Mhm.
leaves a scar for the patient,
Mhm.
and they are not the same as they were coming into the hospital. So if we can, hospitals in general, our vision are that hospitals are not a good place to be in the first place.
Mhm.
So if we can keep people at home and do the treatment at home, this is going to be amazing, and that's where I think this technology can help the most, keep people healthy at home.
So that's a fascinating point. What type of clinical factors are when a person wears the Aura ring or the T-shirt or the Apple Watch, what type of clinical factors are you looking at that might detect inflammation and might signal to the care team that this patient is in the first stages of distress?
So basically the algorithms sense signatures that are too complex for us to perceive, right? So, for example, if you look at heart rate or breathing rate or temperature, like we say,
Mhm.
so usually when you we look at traditional medicine, you look at the graph and you see a spike
Yeah.
in one of the parameters.
Mhm.
But the beauty of AI is that we see a combination of it's like a signature of respiratory rate, heart rate, temperature, movement that signals that, hey, the immune system is activated. So
Oh.
sometimes we look at these individual factors and you say, I mean, we also look with our clinicians, they say there is nothing here. But then 2 days later, the patients start to develop symptoms.
Mhm.
So, but then it's really essential for us to give clinicians also tools that they know how to interpret, because okay, we give them this inflammation level. What am I supposed to do with it, right?
Yeah.
So, so we also collect. We really believe in human in the loop. So we also ask the patient how are you doing, and we integrate this with our inflammation detection and the basics, which are breathing rate and heart rate. And eventually you'll see that, especially in respiratory diseases, breathing rate is a very important component. And
Mhm.
again, the temperature is a late marker, but really the looking at the breathing pattern, this is the most important part for us.
So all of this academic research and your interest in prevention, Dr. Hadid, has led
Yeah.
to your creation of your company, Sensify Health. Can you talk to us a little bit about how your company is working to make these products available to end users, and how an organization could engage with your company?
Yeah, that's a good point. And because we are established in Canada, it's a very different health system than in the US. But eventually, we want to make it available for all the population of the world. And we took a strategic decision that we are going to make this technology available to all the people that need it, right? So vulnerable population, people in underserved regions, even you can think about people that live very remote areas. These are the people that will benefit this for the most, but they also need access to this. So not all of them have wearables usually, and
Mm.
so we actually had to develop the whole business model on
Oh.
how we make this whole package, including the AI and the system and the connectivity with the provider, include it in a business model that will make sense for the payers and for the providers. So, for example, we have like three different ways that we work with our technology. One is working with wearable companies that
Mhm.
have huge ecosystem with wearables and their mobile phones and stuff like this, and they need actually clinical value on their health platforms, because just
Mhm.
to track steps and heart rate doesn't tell patients, again, does not inform patient what I'm going to do tomorrow, right? But if you
Right.
give them more valuable insight that is related to their condition, then they can take more informative decisions. So this is
Mhm.
on I would say what we call the general wellness side, right?
Mm.
Then we work with pharma companies that develop antivirals, and you can imagine that we have very powerful molecules that can actually reduce the the damage caused by COVID, flu, rhinovirus, and other viruses, but we are not
Mhm.
using them. The reason is that by the time that people arrive to the clinic or to the hospital, it's too late to give an antiviral. So you really need to detect it early in order to give the antiviral. So we help pharma companies to detect when is the right time to give the antiviral treatment. So that's the second way that we work. And I think that the holy grail, and this is where the impact that we are aiming to do, is actually to work with big payers and health systems in the US and Canada. And I
Mhm.
think that we are working together with them to make our technology available for the high-risk patients. And again, you can look at respiratory disease, chronic disease patients, or cardiometabolic disease. There are, I would say, significant percentage of the population that will benefit from continuous monitoring and real-time AI with intervention that can save their lives. So for us, this is the end goal. We know that, like you said in the beginning of this discussion, you need to build the evidence in order to get adoption by clinicians, right? So big health systems will not use technology that is not proven. And we are working also to go to the FDA and to approve this technology as a breakthrough designation device. We do not believe in shortcuts, but eventually, we are going to give a very responsible and powerful AI that will be available for high-risk patients. That's our goal.
That's an incredible goal, and you're very close to making that available to so many patients, not only in Canada, but the US. But one of the things that we do need to address, and what you brought up, is that Canada has a very different type of health system than the United States does. And
Mhm.
so, for better or for worse, US health systems and hospitals and patients have to worry about this landscape of reimbursement that is laid out by the Centers for Medicare and Medicaid Services and private payers.
Yeah. Yeah.
So when we think about, you know, the actual technology and we want to make it available in the United States, we also know in the US that RPM technology is reimbursable. Wearables are reimbursable. But the problem is that they are on paper, but a lot of times when hospitals and health systems seek reimbursement, that reimbursement is denied. So what do you see as the major policy roadblock for your company being able to be operational in the United States and form these partnerships with these large health systems to make this technology available to truly like the underserved patient populations?
Yeah. 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 These are good points. And if you look at remote patient monitoring as an example, so the friction around the reimbursement is a main limitation, right? So
Okay.
they need to get to a certain amount of data exchange per month in order to make the eligibility, and then it's month by month. So that's a lot of back office for the health system to deal with in order to get the reimbursement,
Right.
right?
Mm-hmm.
So I can understand why it's being underutilized from their perspective. But if you look also from the patient perspective,
Mm-hmm.
if I'm a 65-year-old or 75-year-old patient that has to take a blood pressure measurement every morning and then transmit this data to the nurse, and then the nurse needs to do something about this and then call me back,
Yeah.
we realize that patients don't like to feel that they are sick every morning, right? Well, so it's a ritual that makes them feel bad. It doesn't help them to feel healthy. So
Mm-hmm.
also the underutilization is because patients don't like it. Uh, but what we have learned with the wearables, which are, and this is an anecdote, but we have like a beta testing group, people that started to use our system, and give us feedback. and we were sending like the most basic Oura ring, which is like silver, heritage, whatever, right? And then older adults, with chronic disease, they said, no, we looked in the website of Aura and we've seen that they have this gold finish. We want the gold finish. And then I had this eureka moment that I said, okay, even an older adult patient with very severe chronic disease want to feel good, want to feel sexy, right? They don't want to feel sick every morning. And then we realized that if we can generate the same level of clinical evidence using something that it's a low friction, it looks nice, it creates a nice conversation with others. Hey, you got the new O-ring. Yeah, the
Mhm.
conversation is different than I just got a call from my nurse because I forgot to take a blood pressure measurement this morning. So I think it gives a different experience to patients. And then to your point from the beginning, how do you solve the reimbursement? I think that the policymakers start to understand that wearables will be the future, and the connected health is going to be the future because we cannot continue and transmit information like faxing points of data. The so I think the amount of data we can generate from wearables every day is huge. We just need to allow it and to make it clinically valuable. And I think that the direction with the remote therapeutic monitoring now is opening additional utilization options. And I think that the first wave of RPM, underutilization of RPM, will actually teach us a lot about how can we make it better. And I think that policymakers already start to make it easier. But eventually, if we reduce the friction around the reimbursement, we will make this available for patients. It will be adopted much easier than before.
So that's, that's a fantastic and really interesting soft data research point that you discovered is that patients don't want to feel sick, right? So, but in a medical clinical mind, you're saying, well, if you take your blood pressure every morning, you take your sugar every morning, and you give us this data, then you won't feel sick. But that act is that physical act of taking your blood pressure, your weight, or whatever it is that chronic condition a patient needs, it makes you feel like you are in a state of not being well.
Right.
And that has an impact on your mental health. But to be able to wear a medical device that doesn't look like a medical device will help with compliance. One of the biggest problems in reimbursement is that RPM has this 16-day requirement. You have
Yeah.
to have
Yeah.
16 days worth of data, but we don't always have patients that are compliant and will
Yeah.
provide 16 days worth of data. So
Yeah.
hence the provider can't receive reimbursement at the end. But here's my question, and so that's a fantastic point that you brought up, that it increases compliance. There's going to be naysayers out there when we talk about remote patient monitoring technology and wearables, and they'll say it's creating alert fatigue among providers. We don't need any more data.
Mhm.
How are you going to solve against the alert fatigue? Because too much information could potentially be just as harmful as not having any.
Yeah, that's a great point. And to be honest, objectively, I think they are already overwhelmed. I mean, I have many colleagues who are practicing physicians, and we don't want to burden them with more data for sure. And especially, you have to give more signal and less noise, right? Because if you send them the heart rate report every day, okay, what am I doing with this? So what we developed is a very nice system that can actually take all this data and then basically have a funnel that shows only the most prominent things, only when it's critical. And we can also
Mhm.
calibrate it individually for the patient. For example, if you have a patient which is very high risk and you want to know on a very small change on their immune system, then you can create a high sensitivity. You probably will get more alerts. But if it's a lower risk patient, you can calibrate the sensitivity a little bit lower and then you will get less alerts. And
Yeah.
then the last thing that we introduced is So first, we don't send the physicians all the data. We just send them when something happens, and we don't send alerts, too frequently. We created additional layer of algorithms that look at the inflammatory data and then look at the context, because sometimes, looking at what I don't like about going blindly with AI is
Yeah.
that sometimes AI cannot look at you and know what are the, we call it external factors, right? But
Yeah.
this is life. This is how
Yeah.
our life works. It's not a set of signals of heart rate and breathing rate. There is much more. Was I excited because my granddaughters were visiting? Maybe I had a half bottle of wine last night. Stuff like this that can impact your metrics, and then it will create a false alert, and then
Yeah.
the physician doesn't need to bother himself because of this. So we created additional layer that take all this context into consideration. And then when we see that this alert was a result of this, changes, we call it stressors, right? But these are external factors that create inflammation. Then we say, okay, probably this person is okay. And then we wait to see what happens tomorrow. And only then if there is something, we deliver the alert. So we think how we shift the friction and the burden from the physicians, and we empower the patients, more and more, because
Mhm.
these people, again, the people that today are 75,
Mhm.
they probably live with an iPhone already 10 or 15 years, right? So they can handle this.
Mhm.
And they told us in the interviews that we've done with them, probably, they don't have as many apps as we do, right? They don't have Instagram and Facebook and WhatsApp and this and that. But if you give them one app that gives them value, they will use it every day.
Mhm.
So we can shift the friction and burden from physicians to the patient, create much better quality of data, and only when it's really necessary, then you send an alert.
Dr. Hadid, it has been more than a pleasure speaking with you today. We are at the end of our podcast, and I just wanted to see if you had any closing thoughts for our listeners, maybe an action item for advocacy for RPM, so we could eventually all be beneficiaries of Sensify Health, and making it an actual tool that we could use.
I strongly believe that the future of healthcare is at home, right? It shouldn't be at hospital. So anything that we can do as policymakers, as physicians, engineers, as patients to push towards, technologies, but also human in the loop and reimbursement that reduce the friction for the adoption will be beneficial for all of us. So, we're going to do everything on our side to make it possible, but it takes a village, right? So we hope that we have more people joining our journey.
Thank you, Dr. Hadid. And that's all the time we have for this episode. And we would like to thank our guest, Dr. Amir Hadid, and to our listeners for tuning in. We'd like you to join us next time as we continue to explore the ever-evolving world of telehealth policy. And for those that are in DC, don't forget our September 23rd Digital Tech and AI Showcase on Capitol Hill at the Rayburn Foyer and the Rayburn House Office Building at the U.S. Capitol, where we showcase to members of Congress emerging technologies in telehealth, remote monitoring, and artificial intelligence. We thank all of you for listening, and we'll see you soon.